Welcome back to our 5-year nursing tutorial YouTube channel. Last class we had discussed regarding the Hodgkin disease. Some of the questions I had given on the topic Hodgkin disease, congenital megacolon. Some MCQs I had given. That answers I am going to show just. First one is C, second one is A, third one is A, fourth one B, and fifth one is A. In this class we are going to discuss with another one disease, that is Spina bifida. First we will see that what is Spina bifida. Here this is the vertebra and this is the spinal cord. Vertebra and then this one is the spinal cord or spinal canal, you can say. This is the normal one. This is normal one. But in Spina bifida, what happens in the sense, here there will be the small opening. Small opening will be present. That opening, that is neural tube defect. Neural tube defect, that is nothing but a Spina bifida. Here there will be the incomplete closure of the vertebral column. Incomplete closure of the vertebral column is known as Spina bifida. That is a neural tube defect. And then one more important thing is, this occurs mainly in a common site, that is in the lumbosacral region. It most commonly occurs in the lumbosacral region. Many times this one is asked in competitive exams. That neural tube defect, that is Spina bifida, most common area, the most common site is lumbosacral region or lumbosacral area, we can say. Next we will see the definition of Spina bifida. Here it is also one of the congenital disorder. Here congenital defect of spine in which part of spinal cord and its meninges are exposed through gap between vertebrae. What happens here in the sense, it is in a fetal spine and spinal cord does not develop properly in the womb. That is exposed to a gap between vertebrae. That is, this is called Spina bifida. And next we will see the types of Spina bifida. Your types. Here main there are two types. One is Spina bifida occulta. Another one is Spina bifida cystica. Here it is in a closed type. It's in a closed type or hidden. It's in a open, like sac, lumbosacral. It is an open one. In cystica there are again two types. One is meningocele, another one is meningomyelocele or myelomeningocele. Meningocele and myelomeningocele. These are the types here. Spina bifida, it is divided into two types. One is Spina bifida occulta, another one is Spina bifida cystica, and then it is a hidden type. It's an enclosure in a dimple-like gap, and then it is an open type. That is meningocele and the myelomeningocele. Here in occulta, this is vertebra. I am showing just occulta, how it is placed. Here, tough bunch of hairs will be present. This is occulta type. This is occulta and this is enclosed. Enclosed. This is a closed one. And then we see meningocele. This one is a meningocele. This one is a meningocele. Here what happens? Here it's a protruding out. That is, here meningocele is there and then CSF is there. In meningocele there is the protruding out, that is CSF plus meninges. This one is a cystica type, that is meningocele. Next we'll see myelomeningocele. What happens here? This one is a vertebra, and then what happens here in the sense? Here it is protruding out. Here CSF is there, spinal nerve is there, spinal cord is there, and then plus meninges. This kind will be present here. That's what it is myelomeningocele. These are the types of spina bifida. Here in spina bifida, this one is the most dangerous one, that is myelomeningocele. Next we will see the causes. Causes for this one. This is spina bifida, and then first cause is, that is exact cause is not known, exact cause is unknown, and then deficiency of folic acid during pregnancy of mother, and then diabetes mellitus, teratogenic factors like alcohol and smoking during pregnancy by the mother, and then medications of epilepsy, infection of torch. Here toxoplasmosis, rubella, cytomegalovirus, herpes simplex virus, and then HIV, and then this extra S stands for syphilis. These are the causes for spina bifida. And the next we will see the signs and symptoms of spina bifida. First there will be the weakness or paralysis, that is weakness or total paralysis of the legs, and then bladder and bowel problems. Of the loss of sensation will be present, and then orthopedic malformations, bone deformities, orthopedic malformations such as club feet or problem with the knees or sometimes hips. These are the signs and symptoms we can see in the spina bifida. Next we will see the diagnostic evaluations for the spina bifida. History collection, physical examination, this one is must and should, and then X-ray, CT scan, MRI, and then amniocentesis. What do you mean by amniocentesis in the sense? It's one of the prenatal tests. It's a prenatal test. They are going to collect the this one amniotic fluid around the fetal in the uterus. That is amniocentesis. Next, we'll see the management. Here, it's a surgical management, and then here in the medical management, that is the symptomatic treatment can be given, and then go to therapy if needed. And the next main management is a surgical thing, that is surgical management. That is prenatal repair of myelomeningocele. Here fetal surgeon is there. That fetal surgeon, it's a delicate procedure where the fetal surgeon opens the uterus and close the opening between the fetal bags, and that is prenatal repair of myelomeningocele, or also it is called as corrective surgery or corrective surgery. Corrective surgery also we can say. And then laminectomy. Here surgical removal of lamina. Lamina is nothing but it's a small part of the bone which makes a vertebra in the spine. This is all about the surgical management, and then these are all the diagnostic evaluations about the spina bifida. After watching this spina bifida, some of the 5 MCQs I have given, you can let me know through your comments. In that, first question is incomplete closure of the vertebral column results in. These are the 4 options I have given. And then spina bifida occurs due to. Options you can select. And then what is the most severe type of spina bifida? These are the options. Next, 4th question is content of meningocele. Content of meningocele is dura mater, spinal cord, brain matter or quadruped. These are the options. And then 5th question. Myelomeningocele most commonly involves which region of spine? Here these are the options. If you watch this class, spina bifida fully, you should not skip. If you watch fully means you can answer all the MCQs which I have given. And then let me know through your comments. Please like, share, subscribe. Thank you.